Today I am going to explain you in this video regarding a entry level NABH frequently asked question and answer. So this is a part 1 and part 2 also will be coming soon. So NABH stand for National Accreditation Board for Hospitals and Healthcare Provider. What are the benefit of accreditation? If a hospital get a NABH accreditation, definitely patient, hospital as well as healthcare workers will get a biggest benefit. So what is the patient benefit? Definitely patient will get a biggest benefit like getting a quality and safety of a patient. They will get a very good quality care and as well as patient safety. So what is the benefit for the hospital? So the hospital stimulate continuous improvement. It enable hospital in demonstrating commitment to quality care. And what is the benefit to the staff? The staff in a accredited hospital are satisfied lot as it provides for continuous learning, good working environment, leadership, and above all ownership of clinical process. It improves overall professional development. All the staff should know the scope of services in the hospital. So they may ask, tell me about what are all the 5 clinical services available in your hospital. So the staff should explain what is the facility they have in a hospital. If it is a multi-speciality hospital, you can explain like a general surgery, general medicine, obstetric and gynecology, pediatric, orthopedic, etc. So whatever the hospital providing a services, that services you should be aware. And in a front office they may ask what is the registration and admission process at your OPD, IPD and in a emergency. So usually registration will be done in a reception or in a front office. So before doing any of the any registration, they should fill up the registration form. So once the patient fill the registration form in detail, the MR or UHID number will be generated. If it is a admission, once the UHID is generated, if the doctor advise for the admission after getting a doctor order, the reception staff responsibility is to make a admission process has to be conducted. Before the admission they should explain in detail of a process and they are supposed to take a admission consent, general informed consent. Next question is, what is your transfer policy or referral protocol for patient to other hospital? Patients who do not match our scope of services are referred to nearby hospital for referral. A referral note is given to the patient attendant. So this is the referral policy. The front office or reception staff should well versed with the referral policy. Next question is, which is your referral hospital? So the front office reception staff and doctors, casualty nurses should be aware on referral hospital name of a other hospital with which your hospital is having a MOU. So whenever you don't have a services in your hospital, so where usually used to refer, that hospital name you should mention. So what are all the 3 important steps in referral policy? So in a referral policy, before referring of any patient, make sure calling to the referral hospital and check for availability of requirement like services, consultants, beds and facility. Fill the standard referral form. If meets the requirement, check the patient general condition, counsel the patient and arrange for ambulance services if it is required. Next question is, what measures are existing to prevent child abduction? You can say all our hospital area is covered by CC camera. Watchman, security guard is available at gate. We are trained in coping and will announce it if anybody tells us that their child is missing. When there is a coping, immediately it will be announced in a PA system. Next question is for all the staff. What will you do in case of accidental needle stick injury, sharp injury, and whom to be reported, including BBF exposure? So the staff should say, wash the site with soap and water. Do not squeeze and do not use any antiseptic solution. If splashes to eyes, then irrigate with normal saline. Report to ICH or CMO. So next questions for the doctor and nurses. What is triage? In case of mass casualty, patients are quickly segregated and prioritized on the basis of their severity of clinical condition by triage doctor like a CMO. Triage nurse will activate a code yellow. Next question is list out the different color code high priority to low priority in triage. So in a triage there are 4 color. Red color is very urgent, yellow color is urgent, green color is less urgent and black color non-urgent. So the staff should know the color coding in a triage. Next question for our nurses. What health education and instruction do you give to patient? The answer is follow up advice, diet, exercise, medication, when to seek urgent care. It is mentioned in a discharge summary. Next question for the front office, reception, insurance, casualty nurses and doctor. What are all the 5 example of MLC cases which you usually handle in your hospital? So in a MLC there are poison, drowning, road traffic accident, hanging, homicide, burns, assault, fighting, chemical or gas injuries. These must be known by the doctors, nurses and reception staff. Next question for the nurses. What is the multi-dose vial policy? So my answer is once you open a multi-dose vial, the shelf life is 28 days or 8 to 10 pricks. Maximum sterility has to be maintained while using and we should not spoil any efficacy of the multi-dose vial and the label should be reflect on the vial. So date of opening and date of expiry should be reflect on the vial. And next question for the OT staff. What does sign in, time out and sign out in WHO surgery checklist? So sign in the sense before giving anesthesia, time out in the sense before making a skin incision, sign out after surgery or procedure is completed. These must be known by the OT staff. Next is OT and ICU staff. What is the modified audit score used for post-op evaluation and transfer of from a OT? So the staff should be aware on monitoring of patient level of conscious, physical activity, hemodynamic stability, respiratory stability, oxygen saturation, post-op pain assessment, post-operative emetic symptoms. So these are all comes under modified audit score. The post-op nurse should aware of these and scoring has to be done before shifting a patient to ward and same thing has to be displayed in the recovery room. And next question is which are narcotic drugs? So what are the narcotic drugs? How do you dispose remaining unused narcotic? So narcotic drugs in the sense fentanyl, pethidine, morphine and dispose remaining in running water in front of anesthetist and witness. After dispose 3 staff anesthetist, OT nurse and one more staff has to witnessed and also will be signed in the narcotic register. So the staff should know the narcotic policy. And next question is once sterilized how many days you can use the sterile set? Again it is depend upon the hospital policy. Whatever you have a shelf life for a sterile set that you can say. What next question is what infection control practices do you follow? The answer is hand hygiene monitoring, using of PPEs, coughing etiquette, cleaning, disinfection and sterilization, horticulturing, autoclave indicator usage, proper biomedical waste management and linen management and also you can say isolation practices. And next question for the nurses and doctors. Where do you report and what document procedure to be completed in case of a blood transfusion reaction? So answer is stop the blood transfusion, report to doctor, check patient condition and vitals, fill blood transfusion reaction form, collect blood and urine sample, send it for lab investigation. Next question for all the staff. What is CPR? How do you manage when patient had a heart attack? So answer is 30 compression and 2 breath. Step: check pulse, check breathing, call for help, announce code blue, start CPR, get defibrillator and emergency drugs, and shift to ICU or call ambulance to shift the patient to referral hospital. Next question is, how do you maintain a privacy of patient, or how do you maintain a patient information confidential? We use curtains while examining female patient. We keep a female relatives or staff while examining a female patient, and we do not discuss about patient detail with outsider, and also will not discuss anything in a public area, corridor or in a waiting area. Patient information is not shared to anybody. So in this way we'll maintain a confidentiality of a patient information. Next question is, what do you mean by disciplinary procedure? So answer is, we have a chance to put up our discussion feedback to management. After hearing it only, management can take a decision accordingly. Next question is, in case of code red, what will you do? So the staff should not get panic and they should follow the raise and pass method. So what is raise? R stand for rescue the patient, A stand for alarm, C stand for confine the fire by closing all the doors and windows, E stand for extinguish. So P pass method is applicable for how to use the extinguishers. So P stand for pull the pin, A stand for aim at the extinguisher nozzle at the base of the fire, S stand for squeeze or press the handle, S stand for sweep. So whenever the fire happens, the staff should follow the raise and pass method. So this is the answer. So next video remaining NABH question and answers will be discussed.